Hey everyone, it's Lorelei here. Welcome back to my channel with up-to-date news and resourceful information on mental health. If you are new to my channel and you find the videos helpful, don't forget to hit the like button down below. As most of you are aware, this past Sunday was World Mental Health Day, and I'd like to share a part of Prime Minister Justin Trudeau's official statement. Good health must include good mental health. That means taking care of our mental health just as we would our physical health. That's why today, on World Mental Health Day, I encourage everyone to take good care of themselves and one another. We all have a role to play in making a difference, fighting the stigma around mental illness and helping ensure everyone has access to the quality care they need. Kindness, compassion, and understanding are key for creating a culture where we can all talk openly about mental health and challenge attitudes that perpetuate stigma and judgment. The COVID-19 pandemic has been a significant source of stress for most Canadians, and our mental health has suffered. Business owners have struggled to stay afloat. Many workers have faced unemployment. Parents have had to adjust to working from home. Students have had to adapt to online learning, and frontline healthcare workers bravely continued providing care, faced with extremely stressful working conditions and the worry of bringing home the COVID-19 virus. We've all made sacrifices to keep each other and our communities safe. This year's theme, Mental Health Care for All, Let's Make It a Reality, reminds us that events at home and abroad can have a compounding effect on our mental health. We have collectively witnessed the tragedy of the unmarked and undocumented graves and burial sites located near former residential schools. Many Canadians lost their homes because of the devastating wildfires across the country. People continue to be victims of racism, discrimination, and intolerance. Violence and atrocities around the world have also shaken us to our core. That's why the Government of Canada is working to ensure that mental health is treated as a full and equal part of Canada's universal public health care system. Last year, we launched the Wellness Together Canada portal, which has been accessed by over 1.7 million Canadians, providing free and confidential access to live support, direct crisis counseling, and helpful mental health and substance use resources. We are also working hard to address the root causes affecting one's mental health by righting some of the inequities in our country. This includes creating safe and supportive communities by investing in charities and community organizations, supporting seniors at home, fighting homelessness, and addressing systemic racism. World Mental Health Day, getting closer to ending the stigma, the World Health Organization says. In an effort to raise awareness for mental health, the World Health Organization, or WHO, has recognized October 10th as World Mental Health Day around the world for the last 29 years. Experts say there has been lots of progress made towards ending the stigma around mental illnesses, but there is still a long way to go. There is no health without mental health, said Tyrone Dua, head of the Mental Health and Addictions Department with the World Health Organization. 2 decades ago, the World Health Organization launched a mental health atlas that shows the status of mental health services in every area of the world to address the gap in services for those in need. In the recently released 2020 atlas, it shows that mental health only takes up 2% of the health budget across the world, and only 1 in 4 people are receiving the mental health treatment that they need while dealing with the stigma. People with mental health conditions, poor mental health, they're also impacted by the stigma, discrimination, human rights abuses, said Dua. Before the COVID-19 pandemic, nearly 1 billion people in the world were clinically diagnosed with a mental health disorder, and the numbers continue to climb. The Saskatchewan Health Authority, or the SHA, statistics show that for the first 3 months of this year, they saw a 35% increase in clients for all of their mental health services. The volume of individuals maybe who never would have before, are now starting to ask for help with their mental health, said the Saskatchewan Health Authority Mental Health and Addictions Co-Director Zoe T. McKay. According to the World Health Organization, the motto surrounding the day is mental health, care for all, let's make mental health a reality for everybody. Quite successful these days, the anti-stigma campaigns that have led us to a day like World Mental Health Day by each and every action of raising awareness, said Teed McKay. If you or someone you know is in need of mental health assistance, you can contact the SHA's Mental Health Services at 306-655-7777. COVID-19 pandemic led to stark rise in depression, anxiety. In Toronto, the impacts of the COVID-19 pandemic on mental health led to millions of new cases of depression and anxiety around the world, a new study from Australian researchers has found. The study, published in The Lancet on Friday, looked at over 5,600 data sets from numerous surveys around the world, focusing on the effect of the pandemic on mental health. They then conducted disease modeling to calculate the prevalence of major depressive disorder and anxiety disorders due to COVID-19. Researchers calculated that in 2020, the pandemic led to an additional 53 million cases of major depressive disorder and 76 million cases of anxiety disorder, representing an increase of 28% and 26% respectively. The researchers found that compared to men, women were twice as likely to experience pandemic-induced major depressive disorder or anxiety disorder. This is the result of women often having to be the ones to take on additional responsibilities at home, exacerbated by lockdowns and stay-at-home orders, the researchers said. Women are more likely to be financially disadvantaged during the pandemic due to lower salaries, less savings, and less secure employment than their male counterparts, the authors wrote. They are also more likely to be victims of domestic violence, the prevalence of which increased during periods of lockdown and stay-at-home orders. Depression and anxiety from the pandemic were also less common in older age groups and more common among younger individuals. People who are 20 to 24 years of age had the highest cases of major depressive disorder and anxiety disorder. This is likely due to the unemployment and school closures disproportionately affecting young people and their abilities to interact with their peers. The COVID-19 pandemic has exacerbated many existing inequalities and social determinants of mental health, said the study author, Elise Ferrari, in a news release. Nonetheless, the researchers say their findings underscore the need for policymakers to strengthen mental health systems. Meeting the added demand for mental health services due to COVID-19 will be challenging, but taking no action should not be an option. If there is a particular piece of news or a video you would like to comment on, please feel free to do so on my channel. Also, if you know of anyone who is going through a difficult time and is in need of help or support, I am always here for them. As always, thanks so much for watching and take care. Until next time. Bye.